Welcome to Next Steps for Seniors, Conversations on Aging with host Wendy Jones. Wendy and her guests are here to help you answer all your questions about growing old. Now, here is Wendy.
Welcome to Next Steps for Seniors, Conversation on Aging. I'm your host, Wendy Jones, and this program was designed to answer your questions about tomorrow, today. And each and every week, we do our best to bring information that's pertinent to you right now. And our topic today is really Medicare and You. And here's why. Medicare is a hot topic right now because it is annual enrollment period. And you have from now until December 7th to make any changes that you're going to make in your program. And we have with us today in the studio, Eric Zawicki. And good morning, Eric.
Good morning.
I'm grateful that you're here with us today. Eric is with Health Markets Agency. It's located here in Troy, Michigan. We are in Michigan. And he is the owner, and he's got over 40 independent agents and does cover across the United States. So you can call him any time of day. Well, not any time of day, right, Eric? Monday through Friday, preferably.
Yeah,
but
sure.
This is a really overwhelming time for a lot of seniors. And I got to tell you, Eric, with all your experience, you've probably seen it a million times. To me, it's very complicated for anyone 65 and over just to figure out and navigate the system of Medicare.
Absolutely.
And that's what you're here to help us kind of manage.
Yep.
And I'm grateful for you because you're very knowledgeable in it. So my first question to you is, when it comes to Medicare, we all know there's Medicare A and B, right?
Yep.
But then there's two paths that you can take.
Right.
And that's where I think people get confused.
Sure.
So what I'd like to do today in this program is talk about those two paths.
Okay.
Which is basically C, right?
Yep.
Part C.
Yep.
Or traditional Medicare.
Right.
So help us understand that. So Medicare, go ahead and give us a recap, because I know not everybody knows A and B, but I do.
No, it's a good question. I think educating yourself on Medicare to start is probably the most important thing, because you got to know your options, right? So the foundation of Medicare, which most people are familiar with, is your Medicare Part A and Part B. So Part A being your hospital or inpatient care, Part B being your medical and outpatient care. Now, once you kind of have that foundation set, so whether you turn 65 or you retired from a job after turning 65 and you get your Medicare in place, to your point, there's really two paths that you have to follow, right? So the traditional path that people did for many, many years is once they got their Part A and their Part B, they would pick a prescription drug program called Part D. So they would use that for their drug coverage. And then they would purchase a Medigap, also known as Medicare Supplement, to help cover the costs that Medicare A and B doesn't cover. So traditionally, just as an estimate, Medicare is going to cover 80%. You're responsible for that 20%. And that's kind of where that Medicare Supplement comes in. It helps alleviate that 20% for those seniors. Now, as time's kind of gone on, and what people are seeing on every other commercial and what people get in the mail every other day, there's a big advantage, or there's a big, marketing campaign for a lot of these Medicare Advantage plans, and they become very prevalent in our marketplace. And Medicare Advantage is known as Part C, and the nice thing about Medicare Advantage, it includes your A, B, and most often D, all into one package. And then the advantage is they can get some of those extra benefits like dental, vision, hearing, gym memberships, over-the-counter benefits, right? There's all these ancillary products that people find to be very advantageous when they're on a budget or a fixed income.
Definitely. So just to clarify, the two paths basically are traditional Medicare, which is also called original Medicare, right?
That's correct.
Okay. So that's your red, white, and blue card, your Medicare card. And with that, you basically get 80% coverage.
Correct.
And if you choose you can get a Medicare supplement or Medigap supplement. Same thing. Those are the two words for it.
Yep.
Correct. And you can only get that supplement with that traditional Medicare red, white, and blue card.
Correct.
So that's on one path.
Yep.
The other path is Medicare Advantage.
Correct.
Okay. So let's go into the Medicare Advantage path first. Okay. Because you were kind of on that. And,
sure.
And I want to share with the listeners, because I'm in Michigan, Next Steps for Seniors, my company is in Michigan. In addition to, we're doing this radio podcast thing. So in Michigan, just so everyone knows, Blue Cross, Priority Health, and HAP are the three big ones in our area.
Yep.
There are national Medicare Advantage programs such as United Healthcare, Aetna, Humana, WellCare, Molina, Cigna, and Mutual of Omaha have some stuff too. So if you've heard all of those names, which don't tell me anybody has it, because they're all over the TV. Every single commercial is all about Medicare.
Yep.
And we all know why, right? We're going to have more people over 65 than ever before in the history of our country because of our baby boomers aging. So they're marketing big time these Medicare Advantage plans. So I would love for you to help our listeners just understand what those are. And like you already helped us with it, it's including A, B, C, and D, which...
Right. That helps out, right?
That's a good start.
A good start is, in because there are so many options and so many plan differentiations, what you got to kind of look at, and what we do with our clients is we like to sit down with them, because there's not a universal best plan, right? Or everybody would have the same plan, and there wouldn't be that many companies that are available. So the best thing you can do is, when you are analyzing your situation, you have to figure out, okay, what plan covers my prescriptions the best? Are my drugs going to be part of the plan? What are the formularies? What are my copays for my drugs? Then once we kind of understand that option, then we got to make sure your doctors, right? So we got to make sure your doctors, your hospital, your dentists are part of these plans. And if we can do a good analysis on your prescriptions and your doctors, then we can pretty much narrow down maybe to 2, maybe 3 options that would best fit your needs and save you the most cost when it comes to picking one of these plans.
So you're bringing up great points, because number one, I feel as we age, our doctors become our new best friend.
Yes.
I don't know about you, but every time I see my doctor, I'm like, oh, my doctor.
Yep.
So it's hard to switch doctors. So I would say definitely make sure your doctor is covered under your plan. So that's a great insight. And then also you said medications too?
Yep, medications are huge.
So how would you recommend they do that?
Yeah, so an easy way of doing it, they obviously can go to Medicare.gov. They have a little portal there where they could add in their prescriptions and they can help determine it. But we do it for them too as well. So one of the nice features of our agency is we have a product that does that analysis. So we'll literally put in their prescriptions, their dosage, how many times a day they take that prescription, what pharmacy they prefer to go to. Do they like to do mail order? Do they not like to do mail order? And we can get it pretty much down to the dollar of what their total estimated cost will be for 2024.
Fantastic. And I got to tell you, that was a great segue into what we're going to be talking about next after we're done with Medicare Advantage, is the advantage of having an independent broker versus going to the big box Medicare Advantage people, because you are familiar with all the different plans.
Yes.
And people can ask questions. But if you go just to one, then you're only hearing that one plan.
Right. That's
so
right.
it's just it's important to understand the difference.
True. Is
all I'm saying. So we're going to talk about that in a minute. Okay. So back to the Medicare Advantage plans. How do you pay for them?
Yeah. So a lot of them in today's society, they have 0 to maybe little premium. Most of the plans so really what happened is Medicare is paying these private insurance companies to help administrate Medicare. So the nice thing for the senior is a lot of these plans have 0 to no cost. So most of that is going to be covered. But what you need to determine is, once we understand the doctor's prescriptions, then at that point we need to go over the applicable copays that customer may be responsible for if they saw the doctor, if they went to a specialist, if they went to the hospital. So that's what we help determine.
You're saying 100% covered as far as their care?
In terms of their premium. Not having a premium pays. Okay. But they will have applicable copays that would be associated with maybe their doctor visits,
depending
or hospital
on what they
stay.
have.
Yeah.
Got it.
Yeah.
Okay. Well, that's interesting.
Yeah. little different.
Very different. And you said it includes dental and vision as well sometimes?
Yep. So most of the plans will include dental, vision, and hearing, as well as over-the-counter benefits and gym memberships.
Yeah, well, I'm glad to hear the gym memberships made it into the dental, vision, and hearing category.
Yep.
I feel like it's important. We need to stay healthy. The healthier we are, the better we are, right?
Yeah.
So I think the insurance companies are figuring that out too.
Yeah, for sure. And we see it all the time. I mean, I would say the two biggest costs, it's not so much medical care that costs seniors a lot. We run into it it's really dental is an expensive endeavor when you're over 65. And prescription costs. To me, those seem to be the two important factors that seniors need help saving on.
So we're going to talk about that in the next segment, along with the advantage of having an independent broker. Mm-hmm. I'm very grateful, listeners, that you can actually ask your questions at hello@nextsteps4seniors.com. We would love to answer your questions. We'll be back in just a moment to talk more about our conversations on aging.
Voice America is on LinkedIn. Connect with us today.
Hi, I'm Wendy Jones, host of the new podcast, Next Steps for Seniors, where we focus on conversations about aging. So, if you're exhausted for caring for a loved one, if you're finding it difficult to make decisions about hospice care, or maybe you're just worried about your future, not wanting to be a burden on your children, we will help you answer those and more tough questions about aging. Join me each and every week as we walk through answering your questions about tomorrow. You can grow old with the wisdom and planning to make your golden years easier on your loved ones. Every single week, our podcast, Next Steps for Seniors, will help you embrace this time in your life instead of be fearful of it. So be sure to tune in, learn more about resources and information to make your life easier as you age. Next Steps for Seniors podcast.
Voice America programs are now available on your favorite connected device, including Amazon, Alexa, and Google Home. Through streams with Apple Podcasts, TuneIn, and iHeartRadio, listening to your favorite show is as easy as saying the show name followed by the word podcast.
Hey, Alexa, play Finding Your Frequency podcast.
If that doesn't work, try adding on TuneIn or on iHeartRadio or on Apple Podcasts.
When it comes to business, you'll find the experts here. Voice America Business Network.
Welcome to Next Steps for Seniors, Conversations on Aging with Wendy Jones. Have a question for Wendy or one of her guests? Drop an email to hello@nextstepsforseniors.com. That's hello@nextsteps4seniors.com. Now, back to the show.
Welcome back to Next Steps for Seniors, Conversations on Aging. Our topic today is Medicare and You. We're talking about Medicare, everything to do with Medicare. Why? Because it's a very hot topic right now. People all over that are 65 and older are having to make a decision, big decisions that really affect their health and their finances, to be quite honest. And that's why this is such a hot topic, and we want to continue to talk about it. Again, this program talks about all the things nobody else wants to talk about, and that's why you're here today, Eric. And Eric can be reached at 248-850-4000. And his agency is here in Troy, Michigan, but can cover nationwide. So feel free to call him, even if you're not in Michigan. I think that that's a good number to have. So quick fact I wanted to share with everybody. In 2023, more than 50% of eligible beneficiaries are enrolled in Medicare Advantage. So I was kind of curious whether, people are doing traditional Medicare or whether they're doing Medicare Advantage. And the truth be known, more people are doing Medicare Advantage. Not a lot more, but more. And there's a lot of people, right?
Yep.
So tell us, Eric, in the last segment, we talked a little bit about dental and prescriptions being some of the higher costs.
Sure.
And I love, by the way, the prescription program that you have, because it is a very big deal for seniors. And when you're on a limited income and you're paying an exorbitant amount for medications, why not be on a plan that will help you with that pricing versus on the wrong plan and you don't even know it? And that's why we're talking about this today. Yeah. So it's worth a call, seniors, if you're on a lot of medications, just to talk to Eric and find out if there's a better plan for you, especially when it comes to that. But dental is another hot topic, and I haven't heard that recently, and I see why it could be, right? Sure. Your teeth only last so long, and you only have one set. So, So talk to us about that.
Yeah, and dental plans, they are going to vary amongst the different companies, right? So having a strategy around that is really very important in today's world. Whether you need a new crown, a root canal, you need dentures, you need bridges, you need implants, not all plans cover the same, right? So getting with a professional and figuring out, hey, what plans do cover my dentist, number one, if I want to stay with my dentist, or am I open to going to a dentist? And then what plans are really going to cover the services I need? Do I need an implant? Do I need a bridge? Do I need a cap? Right? Those things, you got to ask those questions when you're picking your plans during this annual enrollment period. And to me, I think one of the bigger things is making sure you stay in the network. If you want to maximize the amount of benefits you receive on an annual basis, you have to go to an in-network dentist. Because when you go out of network, if your plan covers, it's normally at a much more reduced cost, and your benefits won't stretch out as much as you may like them. So just knowing that little tidbit and making sure your dentist participates can really maximize the amount of money you can save.
I'm sure you know my next question. How are they going to know whether their dentist is in or out? Is there something online they can look at, or do they just have to call the dentist and say, are you in network?
Yeah, so sometimes that happens. So we do look it up online. Most carriers, if you have a particular company that you're a part of, most carrier websites will have the ability to look up your dentist. But a lot of times it may not be updated or maybe not be right on that website. So when I'm with a client and we're looking up dentists and for some reason maybe we're having, a little, difficulty trying to find them, I'll personally call the dentist office and talk to the receptionist or the billing department, and we'll determine what dentists are part of that plan. Because
if you're paying for more money than you think you should be paying, then it could be that it's out of network and you don't even realize it.
Yeah. Yeah, and having good dental is so important to your health. I think a lot of people will neglect dental because they don't know really what they have. They think they're going to have to pay a lot out of pocket. So what happens is you stop getting your cleanings, you stop getting your x-rays, right? You stop getting your exams, and then your teeth deteriorate, and it leads to other illnesses.
Well, it's difficult to eat. Let's just go to the major one.
Right. That's huge. Yeah, it's a huge benefit. And it's a huge way to keep your health top notch, is making sure your dental work is completed on an annual basis.
And all of those companies that I mentioned earlier, United Healthcare, Aetna, Humana Healthcare, all of those have the dental plan.
Correct.
And they're all somewhat similar, the dental plans.
Yeah, similar in terms of how the programs work, but different in the fact that they have their own dental company that they use. So again, your dentist may be part of, let's say, Blue Cross as an example, but may not be part of, ABC company over here, right? Yeah. So really determining and trying to figure out where your dentist is accepted is going to be a huge savings and a huge way that you can really maximize those benefits on an annual basis.
And is like an endodontist, for example, covered usually?
Yep.
Okay.
Yep. Yeah, so endodontists. And
they do more serious work, but yes. Okay.
For sure.
Wow. Interesting. All right. So as you're talking, my head is spinning because I have two questions for you. One is, so let's say you're on Medicare Advantage. You've made the decision to do Medicare Advantage, and you go to a dentist that's not in the network. Would your Medicare, would ever the original or traditional Medicare step in? Or since you made the decision to go Medicare Advantage, you cannot use your other traditional Medicare anymore?
Yeah, traditional Medicare does not cover things
any dental,
like cleanings, exams, root canals, crowns. It will cover some dental services. Obviously, if you were involved in an accident or you had a medical condition that may have done some damage to your teeth, There are some exceptions to that rule, but traditionally, cleanings, exams, x-rays, root canals, crowns, cavities, fillings, that stuff's not covered under traditional Medicare.
Wow. But it would be under the supplement.
No.
Really?
Yeah. So with a supplement program, again, that's just a supplement to original Medicare A and
so,
B.
I mean, to answer our question of why there's more people on Medicare Advantage than there is on traditional could be what you just said, dental and prescription coverage.
It's a big perk of having an Advantage plan for sure.
And this is why Eric is with us today.
Yep.
Wealth of knowledge and very interesting information, because I don't think people understand that. I'm just being totally honest.
True. Yeah.
And that's why our next topic, which I mentioned we're going to talk about, is why an independent broker is so important.
Yep.
Because, and it's you, of course, I would love people to call you, but an independent broker just in general, wherever you are.
Sure.
Explain the benefits of that.
Yeah. So being an independent broker, we have the ability to look at more than one company. I think you mentioned it before. If I call ABC company, they're only going to offer me what they have, right? And what they offer, which is fine, but they're not going to be able to compare other options in my area. As an example, here in Oakland County, we represent 11 organizations, and we have over 91 different plan options. So we can really narrow down some credible and good options for someone that's looking at a plan, whether it be medical, prescription, dental, vision. We do all that stuff for them. So having an independent broker is key for that. The other thing, and I think one of the big misconceptions out there, is there's a cost or a fee. We are compensated, obviously, through the carriers that we represent, and if we do make an enrollment, we do get compensated, but there's no additional fee to that member or that beneficiary. There's no consultation fee. There's no charge. There's no extra cost embedded into the plan or the price. So our services are totally free to the consumer, and we are compensated on the back end by the carriers that they choose.
Got it. Okay. I was wondering how that works. So the client doesn't pay anything to you.
That's correct.
And that's important too,
Yeah.
because the reality is you don't want to sit like an attorney, sit there for paying $150 an hour for consultation about your prescriptions. You're like, I'll just go do it online.
Right.
Google is not always the answer. As much as people like to go online and search on their own, we need an expert like you.
Sure.
And to know the different, because every single person is unique.
Exactly. Everybody's different. There's no question.
There's no cookie cutter. There's no cookie cutter.
Yep.
Yeah. Interesting. So let's transition. We just have a couple minutes left in this segment over to the traditional Medicare and the Medigap or Medicare supplements.
Yep.
Because I think that's important, and I'm sure we'll have to move that into the next segment as well, because these supplement plans, I can't even tell you how many times someone calls and they're like, well, I have Medicare and I get this many days covered in rehab and I get this, but I have a supplement. And I'm like, oh, good. Because it kind of bridges the gap, right? It fills in the missing things that you might not be getting from your traditional or original Medicare.
Yeah. So what a Medigap or supplement is going to do, it's going to cover what Medicare doesn't cover, but it has to be a covered expense. So there's a little confusion there. It has to be a covered expense under original Medicare A and B, but that cost share, that percentage that the patient would be responsible for, the Medigap picks that up. So you have to, once you have that supplement and you want some of these ancillary benefits, you would actually have to purchase a separate dental plan, a separate vision plan, because that is truly associated with Medicare A and B and Medigap. They're 1 and 2. First, primary, secondary is how it is.
So give us an example. Well, we're going to have an example in the next segment.
All right.
Because
let's get an example.
we're running late on time. But I think it's important to have an example.
For sure.
And then I've got a great story, honestly, that I want to share about a client in the next segment as well. You're listening to Next Steps for Seniors. We'll be right back with our guest today, Eric Zawicki, who is Health Markets Agency. And we're going to continue answering your questions about the future you and Medicare.
Follow Voice America at Facebook.com/Voice America for juicy updates from your favorite radio shows and podcasts.
The latest business information is made simple with the Voice America Business Network. The professionals in the business world bring you live talk radio shows featuring an array of business topics, strategies for building wealth, sales and marketing, stock trading, investing, and business technology. Voice America Business hosts are professionals in their fields and bring to the airwaves weekly business discussions that offer up-to-date information, advice, and education. The Voice America Business Network, the bottom line in business talk.
Hi, I'm Wendy Jones, host of the new podcast, Next Steps for Seniors, where we focus on conversations about aging. So, if you're exhausted for caring for a loved one, if you're finding it difficult to make decisions about hospice care, or maybe you're just worried about your future, not wanting to be a burden on your children, we will help you answer those and more tough questions about aging. Join me each and every week as we walk through answering your questions about tomorrow. You can grow old with the wisdom and planning to make your golden years easier on your loved ones. Every single week, our podcast, Next Steps for Seniors, will help you embrace this time in your life instead of be fearful of it. So be sure to tune in, learn more about resources and information to make your life easier as you age. Next Steps for Seniors podcast.
From the boardroom to you, Voice America Business Network.
Welcome to Next Steps for Seniors, Conversations on Aging with Wendy Jones. Have a question for Wendy or one of her guests? Drop an email to hello@nextstepsforseniors.com. That's hello@nextsteps4seniors.com. Now, back to the show.
Welcome back to Next Steps for Seniors. I'm your host, Wendy Jones, and let's continue this week's conversations on aging. Our topic today is Medicare You. And our guest in the studio is Eric Zawicki, and what a wealth of knowledge he is. I'm so glad you're with us today, Eric, because there is a lot of information. Medicare can be overwhelming, really, and everybody's different. That's why our topic is Medicare You, because you are different than the person next to you, your spouse, whoever else. Don't compare your Medicare plans with your friends at the card table, because you're all on a different plan, right?
That's for sure.
So we were talking about Medicare and Medicare supplement and Medigap supplement, which is interchangeably the same thing.
Yes.
And I wanted to tell a story because my biggest concern is, what if someone gets on a plan, right? Whether it's Medicare Advantage or Medicare supplement, whatever. And come January, they're like, oh my gosh, this isn't the right plan for me, because technically everything ends on December 7th.
Right.
So here's what happened to my client is she got on a new plan. Someone talked her into a new plan. And she went to call her doctor in January to make her appointment. And the doctor said, oh, well, we don't take that insurance. Mm-hmm. Now, like I said in the beginning, this is the doctor she's had her entire life. Like, doctors are your new best friend as you age. Sure. So here we are. And she's going, what do I do? So she called me, actually. That's why I know the story. And I put her in touch with, like you, an independent broker, and they were able to help her. Sure. So tell me, how did they help her? Because I thought everything ended on the 7th of December.
Yeah, so a couple years ago, they came out with an enrollment period for really that specific reason. It's from January 1st to March 31st. And you see it more in the Medicare Advantage arena. So if for some reason you picked a plan, and you go to your doctor in January, or you go to your pharmacy in January, and your prescription's not covered, or your doctor's not covered, or maybe your doctor just decided not to be part of that plan anymore. Medicare allows that beneficiary between January 1st and March 31st to make a one-time change. So they could pick a new plan or go back to their original plan during that period of time. It's more of a safeguard for some of the seniors out there.
And it's only for Medicare Advantage, you said?
It's for Medicare Advantage, correct.
Okay, so she must have been on a Medicare Advantage plan.
Sounds like it.
Made the transition, and then definitely freaked out in January when the doctor said, and so went back to the old one.
Correct. Yep.
Well, that makes sense. And that's good to know, because I don't think everybody knows that information.
Yeah, and that happens commonly. I mean, we get calls after January frequently. And it's just maybe an oversight. You know, maybe the doctor decided to pull out of that plan. Those little things will happen occasionally. It's not a perfect world, obviously, and things do change. But that's why you have that little time period, which they call it the open enrollment period, where seniors have that ability to either pick a new plan or go back to the original plan. But again, that's just a one-time change, one-time option.
You can only do it once. You can't do it twice.
Correct.
Game over.
That's important. You got that next decision needs to be the final one for that year.
Exactly.
Yeah.
Okay.
Yeah.
So back to the Medicare Medigap supplement.
Yeah.
So traditional Medicare covers approximately 80%. We talked about, and then the Medicare supplement will cover the 20%. But
Right.
you said something that I think I want to just reiterate to our listeners.
Yeah.
Is that it's only on something that was originally covered by Medicare.
That's correct.
Yeah. Okay. So
for
explain
a supplement to partake in participation of paying cost share, it has to be a covered expense under original Medicare Part A and Part B. So Part A and Part B see that as a covered expense, then that supplement or Medigap plan will pick up, right? So a supplement is great for that, but as an example, it doesn't cover prescription, right? So that's why you have to buy a separate prescription plan. As an example, it doesn't cover dental. That's why you have to buy a separate dental program. So when you go that route, and I think you mentioned the statistics, it's still about a 50-50 split. When you go that route, you just need to make sure that you buy a separate prescription plan, right? If you don't have prescription coverage. And if dental is an important endeavor for you, you got to make sure you buy a separate dental program because that's not part of that Medicare supplement plan.
So you couldn't say, oh, I have Medicare and go to the dentist and get a root canal and then say my Medicare supplement will cover it because
That's
the root
correct.
canal is not covered because a root canal is not covered by traditional
original
Medicare. Yes.
Yeah.
Okay.
And that's confusing. And
No, I can see how
understand
people.
that. Yeah.
Right.
Yeah.
So it's only the items that are originally covered through that Medicare program that you can
Correct.
actually use the supplement to bridge the gap on.
Correct.
Not something completely new.
Correct.
Okay.
Yep.
And can we go back to the prescription in dental? How much does that average? Like, can you give us an idea of costs on that if
Yeah,
someone is
I mean,
on original Medicare?
Prescription's interesting because, again, it's going to come down to what prescriptions you're actually on.
I know. Yes.
And it's going to come down to what pharmacy you prefer to go to, right? So pharmacies sometimes make a difference.
This is my little, I got to get on my, we just had a pharmacy last week. We had a pharmacist on the program. And the number one thing, listeners, if you didn't hear the program last week, is it is critically important to try to use one pharmacy.
Yes.
All these people have different, I get this from Costco, I get this from here, I get this from CVS.
Yes.
And what's happening is the pharmacists don't know the other meds that they're on, and there's some contraindications. And you do not want to be caught in a situation where you're having side effects and things that are happening with the two
Right.
meds combining. So I just had to throw that in there
that's
really
good,
quick because
yeah.
that's what I do,
that's
right?
good advice.
But one pharmacy is important. So go back to that prescription.
So prescription is, so it really comes down to all that, right? So I want to say, they say the national average cost of a prescription plan is right around $30 a month. But again, that's going to vary.
person.
Yeah, that's going to vary based on your prescriptions. So there's no absolute answer there. Dental, on the other hand, again, we're going to make sure that we look up your dentist. We're going to make sure that we find plans that he participates with. But I would say the average cost of a dental plan, if you're buying it on your own, is going to run right around that $40 to $50 mark a month. And that would be a per person basis.
Okay. And so I love how you divided it out in the very beginning that there's two paths to take, right? And we've already learned that it's pretty much split throughout the country. I mean, some people are on traditional Medicare and then they have the supplement, and other people are on Medicare Advantage. And what plan is right for you? My opinion, go to someone like yourself, Eric, who is an independent broker who you actually have an office. Like, people can go sit down in your office, meet with people face to face, eye contact, and have a conversation. You can bring your list of medications with you. What else do you recommend people bring?
Always when they come in, and again, this is via whether we're doing, and we do a lot of stuff via Zoom now too, right?
Oh, there
people
you go.
love Zoom.
I don't know why.
But yeah, Zoom is great, but also face to face is really what I prefer. Most of my clients.
The whole country went Zoom. But so now we can do it
was
any
a
way
big,
we want. We didn't know we could do that before then for whatever reason. But
It sped up technology for sure. But with that being said, I mean, I do like the face-to-face, but anytime someone comes in, make sure that they bring their Medicare A and B card. We need that. The second thing we need is a list of their prescriptions, and then also a list of their doctors. Those are the three most critical things so that we can determine the right plan for somebody.
Now, what about snowbirds? What do you recommend for them?
Yeah, great. I mean, not an issue at all. That's actually one of the questions that we go over. I have tons of clients that live here in Michigan, travel down to Florida for the winter, travel to Arizona for the winter, travel to Texas for the winter, right? Mm-hmm. So we make sure we accommodate them, and it's just making sure that you have the right plan that will give you those travel reciprocal benefits.
Okay, excellent. I mean, this is fantastic information. I think that Medicare overall has been confusing to a lot of people for a long time. And what you just kind of narrowed it down to helps tremendously to people. And I think going to someone like yourself is the key thing, bringing those items with you. How far in advance do you need to make an appointment? I mean, you guys are probably pretty...
Yeah, we're booked up right now, but we have staff here Monday through Friday. They're here from 9 to 5 p.m. and they are scheduling and booking appointments. We probably run anywhere from a week in advance. So I would say a good week in advance would give us enough time to be able to kind of fit you into a schedule that's maybe convenient for you, right? Mm-hmm. So typically if you have a day or time of day that you like, we can give you some options that we have available.
Okay.
Yeah.
And in our last minute, if you could just explain the costs, like your premium that you pay, it comes out of Social Security automatically, correct? Can you touch on that just for a minute?
Yeah. Typically, if you've obviously worked in the United States and you've been in the United States for 10 plus years and paying into the system, Part A is going to be free. The standard cost for Part B next year, again, based on income, is going to be $174, right? So $174.60, I believe, is what it's going to be next year.
And you say based on income, so if you if you're a high earner, it could be higher.
It could be higher, yeah. So people that make above a certain threshold of income, whether you're a single taxpayer or you're a joint taxpayer, they could pay more than the standard premium of Medicare.
Okay, but $174.60 is your baseline.
Is your baseline?
Okay,
yeah, for 2024.
Okay, and that's just for Part B.
That's for Part B, correct.
And then you pay.
And then depending on what path you go, Medicare Supplement, Medicare Advantage, those costs will be in addition to what you pay for your Medicare Part A and Part B.
Right. And mostly for the traditional Medicare, it would just be the dental and the prescription meds that you're paying for.
And your supplement. And your supplement.
So what does that run about?
Supplements are going to be based on age, right? So age, where you live, and depending on how long you've been on Medicare, there's some differentiated factors. So there is some underwriting which can happen with supplements.
So interesting. You're listening to Next Steps for Seniors. We'll be back right after this break to continue our conversation about tomorrow, today.
A little birdie told me Voice America is on X. Follow us at Voice America TRN.
Hi, I'm Wendy Jones, host of the new podcast Next Steps for Seniors, where we focus on conversations about aging. So, if you're exhausted for caring for a loved one, if you're finding it difficult to make decisions about hospice care, or maybe you're just worried about your future, not wanting to be a burden on your children, we will help you answer those and more tough questions about aging. Join me each and every week as we walk through answering your questions about tomorrow. You can grow old with the wisdom and planning to make your golden years easier on your loved ones. Every single week, our podcast, Next Steps for Seniors, will help you embrace this time in your life instead of be fearful of it. So be sure to tune in, learn more about resources and information to make your life easier as you age. Next Steps for Seniors podcast.
Have you become a member yet? Sign up now to become a member of Voice America. It's always free and easy. Plus, you get to take advantage of some great member benefits. Get unlimited access to millions of hours of on-demand content across all of our channels. Keep track of your favorite episodes, shows, and hosts in your own customizable library. Find out what shows you might be interested in based on your favorites. Plus, you get insider access with our newsletter. Membership gives you more. Sign up at voiceamerica.com and click register at the top right.
When it comes to business, you'll find the experts here. Voice America Business Network.
Welcome to Next Steps for Seniors, Conversations on Aging with Wendy Jones. Have a question for Wendy or one of her guests? Drop an email to hello@nextstepsforseniors.com. That's hello@nextsteps4seniors.com. Now, back to the show.
Welcome back to Next Steps for Seniors. I would like to continue our conversation on aging, and our topic today is Medicare and You. And we have talked about a lot of great information, and I appreciate, Eric, all the knowledge that you have and that you've shared with us already. And I wanted to give Eric's phone number again, and I'm going to have him give his website as well. Eric Zawicki, you can reach at 248-850-4000. And that's his office here in Troy, Michigan. But again, you can call and his agents can help you in any area that you're calling from.
That's correct.
Or they'll get you to the right person that can. Exactly.
Sure.
And I think it's important to have an independent broker like yourself, 18 years in the business as the owner, and a place to go to talk to, right? Somebody, a live person, not just on hold with a large company and talking to, voicemails.
Sure, absolutely.
Right?
Yeah.
Because it gets frustrating. But I wanted you to share your website too, if you could.
Yeah.
And any other info.
Our website is and it's healthmarketstroy.com. So health, markets with an S, Troy.com.
Troy, TROY.com. Okay. Awesome. Yes. And you have all this information on there too,
we do.
I'm sure, that we've talked about today.
And ways to contact us. And like I said, the beauty of having a local independent agency is when you call in, you're gonna talk to the same people.
A live person. Yeah.
Same people, so it's convenient.
Yeah. No, it's excellent. And when you have questions throughout the year, you can call that same person.
Yep.
There's something about having your own banker and having your own insurance person that's really nice.
Yeah. We got great relationships with all the companies. So if we need a question or we need some help with something, we have direct contacts.
No, I think it's fantastic. So one of the things we did not talk about in the last segments is, what if you're 65 and you're still working?
Yeah, that's a great question. We deal with that one a lot. People are working longer.
We are,
these days.
For sure.
Not everybody is just hanging up their cleats at 65 years old, right? So one of the big things is when you turn 65, you are entitled to Part A. So you can actually sign up for Part A. It's a free benefit.
If you've paid into it.
Into it for the right amount of time. But if you decide to continue work and the plan you have at work you like, you enjoy, it's cost effective, as long as, and here's the key, as long as your employer has 20 or more full-time employees, you can delay your Part B enrollment until you're ready to retire.
So you would get Part A automatically?
Yes.
Or you have
you're
to do
entitled
something?
to Part A.
Okay.
And you do have to
fill out the paperwork.
Right, correct.
Okay. So your recommendation would be to enroll in Part A because it's free, right?
Yep.
You might as well do it. You've paid into it your whole life.
Yep.
And then you could still take your other plan as long as your employer has that many people employed.
Correct.
Okay.
Yeah.
Interesting.
And people will stick with their employer plan sometimes if it makes sense. And you can keep that, as long as you continue to work for that employer and that employer offers a credible plan. You can delay that Part B enrollment. And I think the most important thing of delaying it, making sure that you will be penalty protected, right? So the penalties are what always comes into play. But as long as your employer offers a group health insurance plan, has more than 20 full-time employees, you can delay your Part B enrollment without penalty. So that's the key. Without penalty, there's no
for how long? As long as you want? Till you're 70?
As long as you're working.
Oh, you could work till 75.
Yeah.
Okay.
You can work as long as you like.
And if they don't have that many employees?
Yep. Then you have to enroll in Medicare Part A and B.
Okay.
You are required at that point.
And at that point, you would be paying
to be penalty protected.
$174.60 a month or whatever.
That's right.
Yeah, because you're not getting Social Security yet, maybe, right? Because you're still working.
And what would happen in that scenario is Medicare would be primary, and your employer plan actually would be secondary.
Oh, okay.
Where the opposite is your employer plan would be primary, and then your Medicare Part A would actually be secondary to the employer plan.
If you didn't do the B.
If you didn't do the B.
Okay.
Correct.
Well, you bring up some great points because we are working longer, and many times I do see. Now, is there a certain amount of money people can make? Because I have seen a lot of seniors working right now that I'm assuming have been on Medicare for years and maybe went back to work. Do you know anything about that?
I don't see that all too common. You mean once they're already on Medicare and they're collecting Social Security, you're saying?
Yeah, exactly. They're on Medicare, they're collecting Social Security, and they go back to work maybe at 76 years old, let's say, for some extra cash.
Yeah.
It doesn't affect their insurance. I mean, I'm sure they don't get insurance benefits.
Right. Yeah, that wouldn't. So what we see actually a lot is that we'll have people that have actually worked to 70 years old, and then they're like, hey, I want to retire next year. What do I do, right? So that's a great conversation to have, and I would recommend if I'm in that scenario, I'm over 65, I'm looking to retire. Maybe I'm looking to retire in January. Maybe I'm looking to retire June of next year, right? Start that process about 6 months before, because there is some paperwork, there are some checks and balances that you have to do to make sure you're prepared for that retirement. So we'll assist a lot of our clients with that paperwork, making sure that they get the proper paperwork filled out, making sure that they get it over the Social Security, making sure that their employer fills out the proper portion. And that way they make sure they have that coverage they need when that retirement date is here. You don't want to delay that to the last second, because then you could have a gap of coverage, right, at that point.
Now, what if a spouse passes away?
Mm-hmm.
Do you just notify Medicare and they stop taking the money out of the account, or how does that work?
So, Social Security notifies Medicare.
Okay.
Yeah, because they know of a passing, they get the death, the death certificate and all that. So they actually notified Medicare, and then Medicare actually will notify the plan.
Okay. So if you're on someone, like, for example, my mom is a teacher, so she's got that plan. And let's say she passes, then my dad can still get that plan, or does he have to change at that point?
Depending on how the group is set up, so that would be more of a group plan administrator. Mm-hmm. But my understanding would be, yes, he would still be able, or still be entitled to that plan if he chose
as a couple.
Because they were married.
Okay.
Yeah.
Yeah, interesting stuff, though. I mean, this is what happens as we age, right?
Yeah.
We don't live forever, so we need to plan accordingly.
Yes, and that's what we see most. I mean, tons of people are working past 65. They're making their money, and sometimes it's just a simple reason. Hey, I want to work past 65 because I want to hit that full retirement age,
right? Where
I can get the maximum amount of my Social Security. Mm-hmm. So it's more common. People are living longer. I mean, let's face it.
So in this last 3 minutes, at the end of every segment, we do a Q&A and a tip of the day. So I wanted to first give the tip, and then I've got a couple Q&A things to go through with you. And listeners, if you're tuning in and you have some questions, you can actually reach us at hello@nextsteps with an S, the number 4 seniors.com. Type your questions, and even if you have a show topic that you would like, go ahead and send that to me as well at that email address, and we would love to hear from you. Again, it's hello@nextsteps, number 4 seniors.com, and you can reach us in the office here at 248-651-5010. But here's my tip of the day, and this is very interesting. Social Security, your Medicare was coming out of your Social Security. And in 2023, it was $164.90 was the baseline. And it's going up in 2024 to $174.70. So I think that's important for our listeners to know that if you are on Medicare, that's going up next year. But here's the big tip. Ready for this one? Social Security is also increasing. So you will be okay that your Medicare is going up, because its Social Security is going up 3.2%. So that's the tip of the day. I think it's good information to know, and it'll offset your additional costs. So here's my question for you in closing. What is the Inflation Deduction Act?
Yeah, so the Inflation Reduction Act was passed a couple years ago to kind of help with obviously inflation, right? Mm-hmm. One of the parts of that was the insulin savings.
Yes, right? Hot topic.
So hot topic, seniors are on insulin. They have trouble with some of the costs. So one of the good things with that, it was capped. So insulin was capped at a $35 copay for a 1-month supply. But here's the important thing to note. You have to have an insulin that is covered by your plan formulary. So again, another good reason why you need to review your plan is if you're on a insulin that maybe is not being covered at $35 copay, maybe it's just not part of that plan formulary, right? So that's just an important, maybe hot topic or note to kind of write down.
No, very important. And there's a lot of people on insulin.
100%.
I mean, diabetes is huge. One of the other things I just want to touch on is everybody, this is the last Q&A, everybody thinks that assisted living, independent living, and care costs are covered by Medicare. Mm-hmm. And you and I both know that answer is no.
Yeah. So
just so you know, listeners, those costs are not covered by your Medicare. Those are out-of-pocket, private pay expenses if you need to move into an assisted living or independent living. Extremely important to know. I wish it was, but that is not the case. So a couple more quick things just as we're closing. The podcast is coming soon, and you can like us, share us, and follow us. And you're going to hear these different programs on all of the podcast stations, Spotify, iHeartRadio, etc. So be sure to tune in. Thanks for listening to Next Steps for Seniors, Conversations on Aging.
Thanks for tuning into this week's episode of Next Steps for Seniors, Conversations on Aging. Be sure to tune in next week for another enlightening and empowering conversation.